I was going to present something about the UK context, and I think, to be honest, there's very little that's very different in that our health literacy rates are appallingly low as well, and we've tried with some of the things that Rima talked about, I think are exactly what we've been doing in the UK without any great degree of success compared to Canada or the US, so I think there's nothing really very new with that. What might be useful is when I was saying to my colleagues that I was going to come, colleagues are always interested in why you're skiving off work as they understand it when you go away. So they said, what are you going to be doing? And I said about health literacy. And what was really interesting, they looked at you like, well, what are you talking about? Because it's not a concept that clinicians actually use. And to me, that was quite interesting because actually this is about making clinical communication to some extent. This is what this is about. How do we make the information that we give to patients more meaningful to them so they can use that to improve their healthcare? And so I was struck by the fact that health literacy is not something we as clinicians are talking about. And then just picking up on what Ted was talking about, cultural diversity, that's an area I've done a lot of work in terms of training clinicians to think about how do you deliver care that's culturally appropriate for that particular patient that's in front of you. And one of the challenges of that has been that it's really difficult to think about how do you tailor care and information for individuals. So, the cultural diversity stuff has a tendency to kind of say, well, this is how you might treat this group of people. And the reality is that actually there's huge diversity in those groups. And for you as a clinician, the challenge is about how do you make the information that you've got at this point in time relevant to that particular patient. So I just wondered whether one of the things about the health literacy is about having a common language that perhaps isn't jargonistic, because I was struck by the phrase that actually a lot of what health literacy is trying to do is about improving clinical care, which is actually a lot of the work already being done in patient-centred stuff, is a lot of the stuff already being done in diversity, and what we're in danger of doing is trying to create a whole new way of doing something that becomes not a bandwagon because it's important work, but you know what I mean, it becomes almost a trend and you forget all of the other stuff that needs to be integrated to actually deliver the information. I guess I'd also want to challenge something about the information that patients bring, and I might be biased because I work in mental health, so the information patients bring is often distorted and dangerous. So what often I have to do as a clinician in the context of work is undoing the information they've got. So it's, I don't know what you call it when you take away information, it's almost saying, this is what we need to have a conversation about. Where have you got your information from? Because actually the meaning of that information, the context and why it matters to them. And I see that as all part of actually clinical care. And I think if you shave off that and say, well, that's about health literacy, it then doesn't become an integral part of the care that you're training clinicians to give. So actually, once we've started saying, well, actually, is health literacy about sharing information in which context, then we can think about, well, how do we get there, which was one of the key messages. And it seems to me that if we want to actually be improving it, which I agree with Rima, that I think we know it's not being done well, so to actually keep finding out it's not being done well tells us what. Should we be thinking about how do we integrate some of these issues into medical school education and also other clinicians? Obviously I've got bias, I'm interested in medical schools, but actually do we need to be thinking about this from way back? There's also an assumption, I guess, that we need to challenge that patients want all the information they're given. Now, we have a great movement about patient collaboration, which is the big thing in the UK. I'd like to think that as competent clinicians we've been doing that all along. But the real issue is there's policy about what patients want to do. The problem is that only is ever based on the understanding or the perspectives of some patients. A lot of patients don't want information. How are we going to make them more literate? Are we saying this is mandatory? Are we saying this is what you have to be health literate whether you want to be or not? And if we are, then what does that say about stakeholder perspectives? And when people aren't interested in their health, how do we get them to be interested? It's going to be quite crucial. And that goes back to the context of conversations. I'm sure those of us who when you ask patients about what it is that they want, and you want to talk about how can they stop it happening. So I get a lot of kids with anxiety, and they will look at me as they'd say, well, isn't it your job to make me better? The idea that they have some responsibility, and okay, it's easier, they're kids, but actually even adults, that they have some responsibility, there are choices that they can make. And I will always say to them, I'm not here to tell you what choices to make. All I want you to make sure is you understand the consequences of each of those choices. And how do we do that in a way that says patients have some choice, but actually are we saying they have all the choice? And we need to have that conversation, because I guess there's almost sometimes a view that if you're clinical, you're wrong and patients are right. And I guess as a clinician, I'm going to challenge that and say sometimes actually patients are really wrong. And how do we have that conversation? And that's not to say clinicians aren't wrong a lot of the time either. I guess that's what I want you to think about. And one of the other issues I wonder in terms of how we can make some change happen is I spend a lot of my time, two roles, I spend a lot of my time teaching and a lot of my time doing clinical practice. And the more and more I've got into it, and it may be because I work with children, so you're always kind of thinking about the information you give them because it has to change. You have to be very careful about the language you use, and I work from 0 to 18, so you're always thinking, is the message I'm giving being heard in the right way? But one of the things that struck me that we don't talk about how we give information to patients, how we present that information, and how do we check back that information that we've given them. And it feels a lot to me like it's actually quite good teaching. So actually when we're thinking about health literacy, do we need to think about basing teaching skills? Because actually if you're going to make presentation skills in terms of if you're going to give information or make people try and understand, you need to go back to some of the mechanisms about what it is that makes people able to hear or receive information or the challenges that you're going to give them. So sorry I've gone completely off piece, but it seems a bit more relevant than giving you slides about the UK, which you probably already know. So that's all I was going to say, if that's okay.
Okay, that's good.